Good afternoon, everybody. This is Dan. Why don't we begin? I see we have quite a few folks on the line, and out of respect for everybody's time, I want to begin by also thanking you for joining us. Meetings today like this are going on throughout all of Trinity. Earlier today, we met with the board, medical executive committee, and our operation leaders, just trying to give everybody an update. And I know the colleagues, you received an email from Mike Slabowski and from myself, and also from Mike Slabowski. Would really recommend you reading that, but also, most importantly, click on the link to the video, because Mike Slabowski, I think, did a wonderful job trying to explain what we're about to talk about and to provide more information. So as we move to the next slide, with all things, we start with our mission. And the mission is why we're here. And I think we've all seen this about Trinity Health, about compassionate, transforming, healing present in our communities. The second thing is our values. I mean, it's who we are. It guides our behavior. And you see those values. And I believe the St. Francis way, we live these every day. And then the vision for Trinity is also about where we're going. And you see that very last line, trusted health partner for life. I really do like that. In fact, I love that. Quite honestly, I love our vision a little bit more, to become Delaware's preferred healthcare provider. So we do have a very strong foundation on which to build. So we want to talk a little bit about where we've been. So with the next slide, and you see our response, you know, this pandemic has had just a dramatic impact on all of us, you know, whether it's our professional life, our personal life, all industries. And really, since early March, it's really been, in some ways, feels like it was a lifetime ago. And I have to say, as I said before, I'm just so proud of everybody in our organization for how we responded to this unprecedented event. And as I like to share, as I shared this morning, and I want you all to hear this, I feel that I work with heroes every day. And I've known that, but it was really brought home just seeing how everybody responded and reacted. And it just really is amazing under some very trying circumstances. So when you think about some of the next steps, or the steps that we've already taken, and this has been throughout Trinity, you know, one of the biggest things is Trinity was able to get enough PPE for us. And I think for us and our colleagues, we felt that, you know, if we had the supplies to take care of the patients, we would take care of the patients. And we have done that. And I'm very proud of the care we provided. Trinity immediately went out to the bond market and the banks and secured a lot of money just to help cover the losses. Little old St. Francis never could have been able to do that. And also, we asked to reduce the spending. We also shut down our capital spending to save cash. We held on Together Care. We are still committed to Epic, but we've just held on it because we needed to focus. And, you know, related to the CARES Act, that was the federal stimulus money, St. Francis received $3.3 million from that, which again is a great benefit to Trinity. If we did that on our own, we would not have received that amount of money. But in comparison, during those 3 months it was supposed to cover, we lost $6.7 million, so it didn't cover everything. And so we had to make some early and difficult decisions. And we had phase one and we had phase two that we already communicated. And some of those we've already gone through in terms of we had to flex down. We had to reassign some folks. We had to reduce schedules. We, as the senior team and all throughout Trinity, we took pay cuts in order to try to help with this. Our physicians, they did a voluntary reduction in their salaries, and I believe that we were up over $125,000 that was donated. And yes, there were furloughs, and yes, there were some position eliminations. Only a few, but there were some. And yes, we went further than other ministries, even in this market. And why? Because we have set as a goal by the end of November, we want to be back to profitability. Because we believe that Trinity is going to be looking at reducing the overhead, but also they're going to look at all 92 hospitals and determine whether they're going to keep all of them. And we want to stay part of Trinity, and we want them to invest in us. And yet, in spite of all our efforts, we've lost funds. We lost money. We lost $90,000 a day in March, $37,000 a day in April, and $90,000 a day in May. And I don't have to say, but I will, that just can't continue if we are to continue. So towards that, we have to talk now about what we're going to do next. And Trinity has used the term emergence, which really, talks about to come out of, to be new, to be prominent, to be important. And I think that's, St. Francis is very important to this community, to the state, and we need to be here in the future. But because this pandemic has had such an impact, we have to make some tough decisions. And, I'm happy to report some of the volume is already starting to come back. Our OR volume for June looks like we may come in right around budget, which was a huge improvement from, I think it was back in April, we were down over 50%. Our physician practices are already back to 89% of their pre-COVID volume. So the patients are starting to come back. ER volume is starting to come back, but it's not nowhere near where it was before. In fact, we're beginning to believe not all of it's going to come back for a while. So you think about if, let's just say 30% of the ER volume doesn't come back, that could be 8,000 or 9,000 visits. What do you do? How do you adjust to that? So when you go to the next slide, what do we know? What are the next steps? Well, first off, we know that the virus is still there. And all you have to do is read the papers. If you're from Delaware, the cases are going back up. They went down and they're going back up. That is not a good sign. And a lot of it's because of people aren't social distancing, they aren't washing their hands, and they aren't wearing masks. And some of it, I get it because of the warm weather and people have cabin fever. But it's going the wrong way. And we have to acknowledge we don't know what's going to happen in the fall. But one of the things I read somewhere, and I love it, is that, we have to prefer action over reaction. And we can't wait. Somebody had said to me, Dan, why don't we just wait until January or February, see where we are? And if it doesn't come back, then we have to make adjustments. The problem is if you do that and it doesn't come back, then next year is even going to be worse financially. So that's why we have to continue. And, one thing, just keep this in mind. Just the impact of the COVID test alone, the cost of doing the COVID test could well exceed over $2 million next year. And there's a high likelihood, especially for the ER patients and for the inpatient, we won't get paid one additional cent for that. So that is all additional cost. But that's something that we have to figure out. And so there's just a lot that has to be done. And some of the other things that we have to do is all right, what are we going to do now? Well, Trinity has looked really hard, and they think that the business is only going to come back somewhere between 80 and 90%. And so Trinity was a $19 billion company. Now it's projected to be a $17 billion company. So we have to tighten our belts, both on the salary and on the non-salary. And so we are looking at everything. How do we reduce our non-labor cost? And we've gone line by line by line. And it's amazing on some of the things we've spent money on that we're not going to spend money on next year. But also we've looked at all of our service lines, and I'm very thankful because of your hard work that from where we were in 2017 to last year, all our major service lines have a positive margin to them, meaning that we collect more money than we spend. That is a good thing, because if they were not, we would have to cut some major programs. We are not going to be doing that. There are a few, and I want to emphasize a few, and I can't tell you which ones yet because we want to talk to those colleagues, but there are going to be a few that lose money that we are not going to continue at this time. And we just feel we need to do that. And back on the non-labor and labor, Beth came up with a great example of the ACLS and the BLS training that we do. Now we can do it online. Just by that shift, it could save us $50,000. Another example, and I know some of the colleagues maybe weren't happy with it, they're getting more comfortable, the self-screening in the morning. Well, we figured that if we kept those screeners there like we were doing for 3 months, that would cost us over $350,000 a year just to screen our colleagues. So we need our colleagues to help screen themselves so we can divert those and use those dollars for something else. And for next year, we don't think all the volume is going to come back. So we're putting our volumes back in so that for the first quarter, 30% of it will come back. The second quarter, 50% of it. And the third and fourth quarter, only up to 80%. Now, that's just assumptions based on now. It could be better. And if it is, we'll adjust to it. But we can't just assume that everything's going to come back and be like it was before. So some of the transitions that we need to do, we need to make more of them. And we can't wait. We need to restructure. We need to resize the hospital and look at everything. So what's this going to require? Yes, we're going to eliminate some additional positions. I cannot tell you the number today, and throughout Trinity, we are not sharing the numbers today. And the main reason for it is that we want to meet individually with the colleagues like we did the first time. We want them to hear it first. But also, there's going to be extended or new furloughs. And I will confirm to you that some of the people out of furlough will not be coming back. It's just some hard decisions we had to make. And yes, we're going to extend or add some new reductions to schedules. Not something that we like to do, but we had to look at every opportunity for us to do this. And this is going to impact every level of the organization because we feel that we need to flatten the organization in order to really have the impact that we need. So, as I shared, we're not going to get into details because out of respect for the colleagues that will be affected. And so with some of the other transitions, you know, if volumes come back, as I shared before, hopefully we can bring people back. Even some of the people whose position will be eliminated in the future, if the volume comes back, we'd like to invite them back. Only time will tell, though. So when we go to the next slide, the colleague transitions, our plan is done. It is into Trinity, and we're waiting final approval. Now, you may be asking, okay, well, our plan is done, but why can't you tell us more? Because there's a reason why we're doing this today. In order for the cost of all of the severance and all of the things that are going to be associated with this to go in this fiscal year, by accounting principles, we have to announce it in June. So we're doing that now. The unfortunate thing is we can't give the detail yet because if you think of all of Trinity is doing this and all of the national organization is doing this, they have 92 hospitals with plans that need to come together, that need to get reviewed by legal, HR, and then an outside review. And that takes a little bit of time. So the affected colleagues, it may be until July 31st that we get all the way through it. But I actually think we're going to go sooner. Don and I were talking about, we hope that within 7 to 10 days, we're going to be able to start to let people know. If we get the green light to go ahead sooner, we'll do it sooner. And again, but we need to want, and consistent with our values, have those one-on-one conversations with the individuals. And so when we go to the next slide, it's a very busy slide, and I apologize for that. But basically, the top bullet point talks about, yes, if somebody's position is impacted, they will receive severance and they will receive benefits in the health benefits, the life insurance, and dental. The second bullet point really talks about, because Trinity is in so many states, there's different notice periods that each state requires. So Trinity has selected 60-day notice period. So if somebody is a position is going to be eliminated here, what Trinity has decided is instead of them being here working during that, they're actually going to pay the people for that, and then their severance will start. So in a tough situation, they're trying to do the best thing they can for the individual. And the last bullet point there is that there will be minimums, but we do believe that they are really good minimums related to notice and to severance. So again, this is hard work, but it's important work in order us to secure our future. And also just a little footnote, not that you would or will, but if anybody contacts you from the press, please direct them to marketing so that they can handle any of the questions. Again, we're not going to be giving out any information. An announcement's going out to the press this afternoon and to elected officials in all of our markets, including Wilmington, to let our folks know so that we can at least begin to, get the word out. So as we try to head home, I just want to following thoughts. And if you look at the quote there by Jeremiah, I think it's very appropriate. Once again, I will build you up, and you will be rebuilt, my dear people. And that to me speaks volumes in terms of what we're about. And the one thing I've been saying to leaders and to the board and the medical executive, I want to say to you, we cannot, I repeat, not go back to everything just as it was before. If we do that, we will have missed a significant opportunity. I think this is going to help us in the long run. I think it already has. You think about how telemedicine has really transformed things, how the surgical staff is now getting people from the garage into a gurney without going to a waiting room. It's working. But what are the other things? And so we need everybody's creative talents to make this happen and to protect our future. And we have a path forward. We created a vision close to 3 years ago, and it was to become Delaware's preferred healthcare provider. We have a strategic focus. That is to really focus on those patients, those high-end procedure type of things, 48 hours and less, because that's where healthcare is going. And we have guiding principles directed by our values about the St. Francis Way. So many of these things are in place. So in closing, what can you do? Keep taking great care of the patients. Do not, I repeat, not let this distract us. I know it's a hard time, and I know it's uncertain until we can actually have the communications, but we will, and that time will go by. The other thing, the second thing is help one another. This is hard times, so we all handle it differently. You know, the team here has been very helpful to me as we've been working on this for several weeks, just trying to figure this all out, and I tell you, it really helps to talk to one another. So be there for one another. Third, if you have any ideas on either how to save additional money or to grow, let us know. Because we don't have all the ideas. We don't have, in fact, some of the best ideas come from our colleagues like you. The next item, the second to last, is advocate for St. Francis. Be advocates for us. Talk us up. Because I think, people are still, as they hear this, they're going to, well, what's going on? But, TogetherHealth just last week announced laying off 1,000 people. And so, I mean, this is happening throughout. I was talking to a young executive for Uber just last night. He said their business is down 80%. Think about that. So it's just not us. And in closing, the last one, recruit somebody to come to St. Francis. If it's a family member, it's a friend. Again, if we all did that, there would be at least 1,100 new patients coming. And I think there's great opportunity. So what I'd like to do is open it up for questions. Brandon, we can do the chat function. So if you would write in your questions, we'd be happy to answer as best we can. And if we can't, we'll get answers. And then our hope is that maybe it's in a week or 10 days when we're able to start communicating with colleagues, we'll have another town hall meeting so that we can give you more detail, because I think you're all owed that. So let's start there.
All right, thank you, Dan. And just a reminder for everybody, the WebEx chat function is open and available. So if you have a question, I would encourage you to take advantage of that chat feature and go ahead and put your question in the chat box.
Maybe to get this started, can you please let us know, was this helpful?
So Dan, we have our first question, maybe as folks think about that, and we have a couple guesses. It was helpful, but here's one. Will providers, doctors, and NPs have the option of working somewhere else in the hospital as opposed to being furloughed?
I would say yes, if there's a need there.
A few more responses. Yes, it was helpful. Thank you for that. So Dan, a question, will people know if they're affected within 7 to 10 days, or is that when colleagues will start being notified?
It will be when colleagues will start being notified. We will, it's like we did before. Once the plan was approved, we feel that the manager and someone from HR ought to sit down with every impacted employee and explain everything to make sure that they understand. So we're going to do that hard work first. And then once we feel that we're through most of that, we'll have another town hall.
Thank you for that question. We have a few more yeses. That was helpful. Thank you. Okay, Dan, we have a question. Is there a voluntary severance option for colleagues who may be close to retirement age? So, Donna, I don't know if you'd be interested in trying to tackle that one?
Yes, there is, and those that might be interested should notify their direct supervisor, and then that supervisor will let me know, and we'll have a conversation about whether or not that would make sense.
Great, thank you, Donna. We have another question here. What is the best method to use to communicate ideas for growth?
Boy, I love that question. Come on up here in the boardroom. We'll sit and talk about it. We would love to have that.
And if you want an easier route, you're certainly welcome to email your SLT member up through your manager, your supervisor, whatever may be most appropriate. But please make sure you take the opportunity to find a way to communicate it. Thank you for that. We have a comment here. Yes, helpful, but adding more stress in the last meeting was giving us a false sense of normalcy.
Well, I mean, I can add that I definitely understand that it's adding more stress. And, you know, since the last time, we have just spent more time and working with Trinity trying to anticipate where the next 12 months is going to go. We didn't have that the last time we met. And because of, you know, if only 80 or 90% of your business is going to come back, you have to address it now. You can't wait.
Thank you for that comment and question. Any other questions? So, Dan, maybe more of a technical question. Will a currently furloughed person get a severance package if the position is eliminated? The slide was a little confusing. So, Donna, I don't know if you would like to address that one?
Yep, somebody who may be on furlough today whose position is being eliminated in the future is eligible for a severance package.
Okay. Another question around furloughs. If people are furloughed, do you know how long it will last? Possibly not, but just wanted to ask.
Right now, I don't know. I think that's the honest answer. I think that
there's a maximum amount of time, 13 pay periods, but it could be shorter.
Right.
Okay, hopefully that helped with that question. Good one. Some of us had a decrease in hours. Could we see being dropped to a part-time position due to the losses?
It's a possibility.
As Donna said, it is a possibility. It's not something we're looking at right now. But, you know, one of the things I should have mentioned, I mentioned in the call this morning, you may know that, I guess it was, Beth, what, 2.5, 3 weeks ago, our census was over 100, and now we're in the low 50s. I mean, I think that's just how volatile it's going to be. So we're just going to have to continue to flex up and down. So we just don't know right now.
So we have a question from Teresa. Teresa, you might have to correct me if I get this wrong, but I think it's other companies are rescinding or stopping contributions to retirement packages to save money. Is that an option that we may be looking at?
There may be information coming from Trinity about those types of decisions that they might need to make.
Yes, I get the sense, I don't think it's been confirmed yet, that that is definitely being considered.
Very good. Dr. Gonzalez or Beth, would you like to maybe just mention where we are with telehealth? Did we already begin telehealth?
Yes, it's begun. It's been consistent in all of our outpatient practices. They've had success with it, and it's something that I anticipate will stay as we continue through Emergence.
Good.
I think it's been a godsend.
Yeah.
One of the things we don't know is if the insurance companies are still going to pay for it, which we're going to lobby real hard. In fact, we were on the phone a week and a half ago with many of our state legislators advocating that that payment continue.
All good questions. Thank you for those. What other questions do we have?
Well, if there's no more questions, I want to be respectful of everybody's time. And I just want to close by saying thank you again for all of your hard work. You are the ones that make St. Francis and have been so instrumental in our turnaround. I have to tell you, from my position, from my view, this is the worst part of being a CEO, knowing you're impacting people's livelihoods. But at the same time, you know, our collective job is to make sure we're here for another 95 years. And we believe with our vision and our focus that we can and will be successful. So I know it's a difficult time, more answers to follow. Please, if you have any questions, ask them of your leadership team member, or email any one of us and we will try to get you answers. And if we can't, we'll say we don't have an answer and we'll try to get you one. Okay, I think that's it. So thank you all. Greatly appreciate everything you do. Take care and God bless.